Well, hey, welcome to everyone. We are very excited to have everyone gathered here. In some ways, this has been a long process. In other ways, it has been lightning fast that I'm sure a lot of you can relate to. So gonna power through a couple slides here. And so first of all, thank you. Thank you for your willingness to serve in this capacity. Thank you for what you're going to do. I'm going to thank you in advance for the difference that we know that you are going to make on the campuses and in the lives of the students that you see every single day. Thank you to the SHA leads that are able to join us today. We so greatly appreciate you taking the time to be here and to help in this process. We know this is in some ways one more thing, one more responsibility, but we hope that it is an enriching experience and that you feel good about it and something that will really make an impact this fall. I did want to give a shout out to UNCA and to especially Jordan Perry, who's on the in the meeting, and to Kenda Mullert, who will be joining in a little bit. But they were instrumental in the curriculum development. And so a lot of the content that we're going through today, they wrote and they greatly assisted in that process. All right, so who we are, who's talking today and who's a part of the training from kind of the staff leadership side. Kenda is not on the call, I believe, or in the meeting. Is that correct at this point? I don't think she is.
I think that's correct.
But Kenda Mullert will be joining us a little bit later. And so from UNCA, Jordan, if you can just give a 10 or 15 second quick introduction.
Hello, I'm Jordan.
That covers it. I mean, that is definitely within the allotted time frame. And so Jordan is the Healthy Campus Liaison at UNC Asheville. Dr. Lane Perry has been our contact in working with Western Carolina University. And he's going to be joining for a part of a brief part of the training this afternoon. And then Cole, if you would like to go ahead and introduce yourself.
Hey, thank you. Yeah, my name is Cole Gold-Layton, and I'm currently your Institutes of Higher Education Back to College project coordinator. I'll be working with each of the leads, definitely at the 4 private institutions, but the 2 public institutions like UNCA and Western.
Okay, thank you. And my name is Steve Emig. I work at MAHEC, the Mountain Area Health Education Center, and I work in program administration as a part of the Center for Health Professions Education team. So I did want to give, I wanted to recognize any of the student health ambassador leads that are joining us today from each institution. And so I know Dr. Hunt has joined us from Mars Hill, so welcome. Are any of the, I believe Dr. Deanna at this point, I think you're on, is that correct?
I am, yep, I'm here.
Fantastic, all right, welcome. And is Ian on from Montreat at this point? Might not be, but Ian Olinger from Montreat, I think will be a part of some of the training today. And just so everyone knows, we're doing this training for the 4 private residential schools in the area. But unfortunately, we were not able to get the logistics figured out with Warren Wilson. And so we're going to be kind of playing catch up a little bit and doing some side training with them. All right, I did want to, so we're very fortunate to have Dr. Amy Lanou join us today, and really kind of the brains in a lot of sense of the grant that has brought forth the Health Ambassador Program to the 6 residential institutions. And so yeah, I'd love for you to say a couple words.
Sure. Thank you, Steve. Wow. I got my own slide. That's so awesome. I've also been called an igniter today. So brain and igniter. I'm feeling on top of the world. Thank you all for this opportunity to work with you to help make our college campuses safe and well under these extraordinary circumstances. We are so lucky to have both the support from the NC Policy Collaboratory, funding to do this work, also support from MAHEC to make it possible to extend this work across the whole region. And we're extremely, not only for the funding, but also for their the team that you'll be listening to today, or at least Cole and Steve are MAHEC employees. So it's fantastic to be able to be coming together. One of the things I'm so excited about this project is this regional collaboration between these institutions of higher education. And I think, I love the notion that that collaboration is going to keep digging and digging deeper to where students at the different universities are going to be working together to move the whole region to a safer and more well place. So thank you for being a part of this. I'm excited to have the opportunity to come to know you, work with you all. My role is, you won't see my face as often as I would like, but feel like I'm available, and really to any of you for any support that you might need moving this forward. Steve, was there anything else you wanted me to address? Oh, I do want to say one more thing. Jordan introduced herself as Jordan, or herself as Jordan, but they are also the lead, one of the two leads for the Student Health Ambassador Project at UNC Asheville. So, and doing some really, really important work there. So.
I did it once already. I was muted and trying to talk, so I'm sorry about that. Okay, well, thank you so much. So moving right along. So just kind of some logistics for the day that we want to make you aware of. So we've incorporated some video as a part of it. We will be trying to use the chat function, just kind of an easy way to convey some quick information and to keep hopefully some interaction going. We know we're pushing it with a 4-hour training. We're going to give you a little break in the middle. But we'd love for this to be interactive, and we really want this to be a great afternoon for all. So we'll be doing some breakout rooms, some polls will be a part of it. I put that next point in because I am still learning how to do some things along the way. So I think I know now how to mute you if I need to, but just to try and watch feedback, be mindful of that. So we'll try and be on mute as much as possible there. And if you have not already done this, in the next little bit, if you can work on trying to just rename yourself, you can look at how others have done it. This is for the students particularly. But if you can just put your school in front of your full name, that will help when it comes to sorting you for a couple different breakout rooms. So we would appreciate your assistance in that. Okay, let me stop sharing my screen. And actually, I should have kept it up there because now I'm going to need to tell you what to do. And so in the breakout rooms that I'm going to put you in a minute, I tried to keep this really easy, really fast. This is going to be like a 2 or 3 minute breakout room at most. But if you can just introduce yourself, so share your name, share your pronouns. So for me, he, him, his. And then if you can just share something that you are proud of, something that you are proud of. It's kind of a quick conversation, you know, get going, kind of an activity. But let me form some quick breakout rooms. Okay, and I'm going to open the rooms. And so again, your name, your pronouns, and something that you are proud of. All right, welcome back. Welcome back. I'm sorry that was a little bit longer. Dr. Hunt, I wanted to just give you a quick update. I think we fixed that for Hunter, so hopefully Hunter is able to join us.
Excellent. Thank you, Steve.
Absolutely.
And Jordan.
Okay, so let me share my screen again. Okay, so just transitioning to talk an agenda here for a second. Again, we know we are trying to get a lot of content into a relatively short amount of time, but we're gonna do our best to make it informative and hopefully fun along the way. But we will talk about the role of the ambassador coming up here soon, COVID-19 basics. Evaluating health information. We do want to give you a quick break, so just kind of plan on about 2:50 is when we're going to try and take that break approximately. We'll look at state, community, and campus policies, supporting your peers, bystander intervention approaches with a heavy emphasis on scenarios that might come up along the way, and then some wrap up and logistics and some next steps along the way. So just so you know where we're going here. All right, so looking at the role of the ambassador, just to highlight a few things, and I'm going to talk just for a couple of minutes, and then I'm going to turn it over to a few folks to explain what's going on the Western campus, and as well, hi Dr. Perry, thank you for joining us, as well as the UNCA campus. So kind of the general description, if you will, of the student health ambassadors. Participate in training. What you're doing right now, you are doing your role. So you are learning about COVID, you're learning how to support your peers, you're learning how to be a great role model. I'm sure some of these things, obviously, you already are doing. But we want to try and help you along the way when it comes to COVID specific information and helping you to really make an impactful difference on your campus. We want you to engage in safe practices. So we want you to be a role model in a lot of ways, whether it's on campus or off campus, that we hope that really comes through. We want you to educate and support. This may or may not be happening on all the campuses, but when it comes to supporting students in isolation or quarantine, that could be a possible role of the ambassadors. And so a part of the beauty in my mind of this program is that it can be tailored to each university or college based on the needs, based on the number of ambassadors, and they can make it work for their setting. Temperature checks may or may not be a part of that responsibility. We know that some institutions are certainly thinking about that. Develop social media and print communication, and so we want you to be a communicator about getting the word out, helping to educate, helping to support. Provide feedback to campus leaders. And so the more, we already believe that there is a great level of buy-in from the campus leaders, but if you can be a liaison in a lot of ways between administration, between various individuals on campus in leadership positions, we think that will help your ability to really thrive in the ambassador role. Communicate regularly with fellow student health ambassadors and advisors. and work about 10 hours a week. And that's kind of, that was in the job description. There's a couple institutions that perhaps hired 6 at the private institutions that hired 6 ambassadors. And so you might be working a few less hours, but generally speaking, we're talking about 10 hours a week in most cases there. All right, I do want to emphasize a couple things. So ambassadors are not expected to provide medical care or enforce campus policies. This is something that I know has been, I think, on Jordan and Kenda's hearts in a lot of ways on the UNCA campus. And so moving forward, you know, as you get started in that role, keep that in mind. You're not expected to be a clinician. You're not going to know everything, but we are going to hopefully get you a very, very solid foundation in a lot of ways. And then we don't want you to be the cops. We think that that takes some of the credibility away from the position if you're constantly in a position of enforcement. So the student health ambassador leads that are a part of the training today, that would be our recommendation, if at all possible, to keep that in mind. That's what we have tried to emphasize along the way. I did keep this slide in from the UNCA training because we're all finding our way with this. And so this training is going to be hopefully a great foundation. We are going to keep figuring this thing out together. None of us that I'm aware of have been through a pandemic before. And so we are all navigating these waters, these uncharted waters, and trying to figure out the best course of action. All right, I am excited to turn this over because this is a little window to hear what's taking place on the Western Carolina campus, as well as the UNCA campus. So Dr. Perry, if you could just share a little bit about what's going on with your work.
Excellent. I'm going to keep this to about 5 minutes. It's so awesome to see all of you today. Honestly, you are so important to helping ensure that our campus's safety is prolonged through the fall semester and beyond. So you all are playing such important roles. I could say that theoretically last week. Theoretically, this is a cool idea. After 1 week with our ambassadors on the ground, I can say beyond a shadow of a doubt that this is concretely very important. So what we have here, some photos of our Catamounts Care ambassadors out doing what they do best, helping witness wellness and positively reinforce the types of behaviors we want to see on our campus. So we've taken those role descriptions that we just went through, thank you, Steve, for that, and we've put it into these 3 veins. Our goal is to educate and inform our campus, be a seen example, and to positively reinforce the types of behavior we want to see on campus that bring to life our Catamounts Care public health campaign. So let's look into this a little bit more deeply to learn more about what our students are doing. So, Steve, next slide. So what we've done is we've taken our campus and divided it sort of into 3 zones, zone 1, 2, and 3, based on trafficked areas on campus. So for the first 2 to 3 weeks, we have our ambassadors out on what we're calling witnessing wellness walks. These ambassadors work in teams of 2 at best, and sometimes they're on their own, on 2-hour shifts between the hours of 9 and 5 p.m. And these students are out in these 3 zones, and they have an apron that are filled full of some resources that they might need out there if they come into contact with students who need hand sanitizer, maybe an extra disposable mask, if maybe they're not wearing a mask and they forgot theirs and they want to have one. We've given that tool to our ambassadors. And they're also equipped with these bad boys. These are stickers right here, and they're the Catamounts Care logo for our whole entire public health campaign on our campus. And the students have these in little Ziploc baggies, and they pass them out to students that are emulating the behaviors we want to see on campus. And so the goal, we've distributed about 1,000 of these at this point, and our goal is to get around 3,000 of these out and about on campus. Students put it on the back of their phone, they put it on their water bottle, they put it on their laptop, and once a student accumulates 5 of these chestnuts, they then can come to our pop-up store and convert those 5 stickers into a water bottle or one of 100 free cups of coffee at Starbucks, or maybe one of our Catamounts Care t-shirts that are in vein of our theme. So we have a little story and an incentive around being caught doing well is one of our campaigns. We also have one, hashtag Netflix and Heal. in the event that someone actually comes down with COVID. We've sort of got some spins on this, and so that really speaks volumes to our extension of our public health campaign. So students sign up by Sunday night every week for their shifts across the week, and they need to do 3 to 5 shifts per week. Like I said, this is for the first couple of weeks. We're trying to get a grip on what's happening on our campus. And we have teams that I'll get to here in a second on the next slide when I call for that, Steve, that the students are doing some team-based work as well, which you're going to hear the best team example from UNC A here in a second on how they've done it. Now, the last thing I want to say is at the end of every one of these shifts, as we're trying to get a pulse on what's happening across our campus, we have a 10-question Qualtrics survey that students report out on. What shift are they on? What day of the week? What time is it? What zone are they in? And we ask them, how many positive interactions did you have on your shift? How many challenging interactions did you have on your shift? And what is your overall vibe? Smiley face, neutral face, sad face with regard to the culture that you feel like you're witnessing across campus. And we have a chance for them to upload a selfie photo, which you saw a couple of those a second ago. And we have a chance for them to offer qualitative feedback. So we've learned that the basement of the library, students aren't wearing masks. They feel like they're outside. So we're working with the library to do an internal campaign there to get caught doing well inside the library. So you can see across there at the bottom, the first 35 shifts this week has demonstrated roughly 8 to 10 positive interactions for each shift, which is good. That should alleviate any concerns you have on what issues you might run into on the front lines on campuses. And you can see that they're having roughly 2 sort of challenging moments, which we'll run through scenarios later that'll help reinforce that. So Steve, last slide. I made reference to also weekly team meetings that we have going on. So we met last night just to decompress the week. What are we seeing? What are we feeling that maybe the survey is not capturing? And we have our team of ambassadors organized into litters. These kitty litters, these litters of kittens or catamounts. We have one that's around the pop-up store and converting these bad boys into currency that students are actually going to want. So they got a team that's coming up with that model. We have an information table intent that's going to be posted up once we start getting past the first 2 or 3 weeks of witnessing wellness walks. And we'll continue those, but just not at the intensity that we're doing right now to get a pulse on our campus. We have a social media team and then a voter registration team as well. So the thing I want to say is to remember, great opportunity comes with great responsibility. That's the opportunity you have before you. We want you to be leaders. We want you to be seen. We want you to be positive, be an example, and be a bulldog or a catamount or an eagle or a white squirrel that, you know, that cares. And so we're all here for you, and we are in solidarity in Western North Carolina doing this great work. And thank you to MAHEC and UNCA for making it possible for all of us to be here. Thanks.
Dr. Perry, thank you so much for joining us. We're going to transition, but Dr. Perry will be around for a little Q&A here in a second. So be thinking of some questions that you might want to ask either about the Western program or about the UNCA program coming up here. So transitioning to UNCA, and Jordan, I can do it, or if you know, feel free to jump on in.
Yeah, I'm happy to talk about it. So again, my name is Jordan Perry. I use she, her, they, them pronouns. I'm actually not related to Dr. Perry, but after that inspiring presentation, I kind of wish that I was. So our team is pretty big. We've got 45 student health ambassadors on board at UNCA. And to manage a team of that size, what we've done is we've broken the groups into teams by interest. And you can see the teams listed here on the screen, and here's some screenshots of our student health ambassadors in training. They did their training a couple of weeks ago, so we're just a little bit ahead of schedule on you and have some experience to share based on that. Next slide, please, Steve. So our teams are set up with, many of them have a team leader, a student team leader, and then at least one, some have more than one faculty or staff advisor. So that's in addition to Kenda and I as the coordinators of the program. We are having them do weekly check-in continuing education meetings as a general group, and then they're also meeting with their teams. We are staffing 5 support stations across campus, and we've been working really closely with communications and marketing on developing materials, including some really great videos that I think Steve is going to reference earlier. But I really wanted to just hold space for you to hear from some of the student health ambassadors themselves. We've got Alexis Baker and Haley Rainey here with us. Alexis is on the athletics team and Haley is on the communications team. If y'all want to unmute and share a little bit about what your experience has been like. Alexis, I'll ask you to go first, just because your name starts with A. And then Haley, if you don't mind going after Alexis. And then I think we're taking some time for questions.
Hi all, my name's Alexis. So the biggest thing that I could advise upon is really, if you are an athlete or if you're involved in an art club or anything, you are the example. I think that's been a key part of our ambassador program, is that we have so many people that are setting the example for not only their teammates, their peers, but also just people in their classes. And I know I'm not the only ambassador that this has happened to, but we've had people in our classes ask questions. And so that's really the biggest thing, is being able to educate your peers. And we have had a lot of email communication and videos posted on our social media page. However, that doesn't mean that everybody has watched them or read the emails. So just being open and being prepared to answer those questions has been huge. And at our support stations, we have stress balls, hand sanitizer, tissues. So using those items like the Catamount stickers, I think that's a really unique idea, to get people to come engage with you, because that's one thing that they're not going to do, is they're probably not going to come up and ask questions without either you being outgoing or without some type of incentive. And that's been a great way for us to gauge how people are feeling across our campus. For the first week, there was a negative energy. However, after having seen how well our campus has done, a lot of people are very positive. They're ready to buy into wearing their mask and following the 3 W's. So that's been the biggest takeaway for me being in this role as a student health ambassador, is 1, knowing how important the education is, just coming from a peer, and 2, being able to be a support on campus. You know, some people may feel like their questions aren't major questions. However, I've learned that even the simplest questions are major to some people.
Thanks, Alexis. I want to highlight something Alexis said here about being open to questions. And you don't have to have all the answers, right? I think that in fact, it's a real skill and an important trait to be able to say, you know what, I don't know, but let me find out and get back to you. Saying I don't know is really powerful, and then following up. And more so than being an expert on everything there is to know about COVID-19, because let me tell you, I don't know, Steve doesn't know, Dr. Perry doesn't know, Dr. Lanu doesn't know everything about this. And the guidance is changing, right? Being able to say, I don't know, but let me connect you with somebody. Let me help you figure this out is so, so powerful. Thanks, Alexis. Haley?
Hi guys, my name's Haley. I am a communications major and I'm a senior. I'm about to graduate next semester. And I, like Jordan was saying, I'm on the communications team, which includes like running social media such as our Instagram and posting flyers out, getting like communication out. We also do like general jobs like taking temps and tabling where we hand out stuff. And, you know, like Jordan was saying, I think the biggest thing that I learned in training was, you know, you don't have to know everything. Really, you're just an educational tool that people can go through. And I like the thing that we say about the not policing, because that was one of my concerns about first having this job, was that I'd have to be like a hall monitor, which is not the case at all. I feel like we're more influencers and educational tools than anything. But yeah, if y'all have any questions about running a social media page or an Instagram page, please let me know.
Okay, well, thank you so much for sharing there. We do want to, I think we have about 10 minutes to just open up a little bit of Q&A. And so I'm thinking and hoping that that sparked some questions. Probably the easiest way to do this is to put your question in the chat, and we will try and get to as many questions as possible here. So if if something is stirring, please go ahead and put that in the chat, and then we'll open up responses from Dr. Perry or from Alexis or Haley.
I know it takes a little while to get a question typed in. I was just going to ask Haley about one of the things that we were thinking about earlier today is how do we understand our reach to students who aren't regularly coming to campus, those who have mostly an online. And I wonder if you had any ideas about that with your sort of focus on social media.
Right, yeah. So our social media, like our Instagram page is what we mostly use, is still growing. I think right now we have like 70 followers, so it's still a small account, but we're trying to spread the awareness as much as possible because, yeah, like you were saying, you know, not everybody is coming to campus every day, and being able to see like the student health ambassadors being visibly present on campus. So I think the biggest voice that we have is definitely on Instagram. And what we do on the Instagram is like we share informational graphics from like the CDC, and some of our other communication staff members have made graphics for us, which is very cool to see other students' art on the page. We like to share videos that, like, you know, I think one of them that we were about to share is how to effectively wear a face mask, which a lot of people, you know, we're still trying to get the correct information out there, especially since new research just came out that, you know, the gaiter masks aren't as effective as the double cloth-sided masks. So yeah, we're really focusing on getting as much outreach as possible right now.
Okay, Alexis commented to everyone, in addition to in-person support stations, we also offer SHA office hours via Zoom for those not on campus. Dr. Perry has a comment there. I'm going to try and just kind of do what I can with sifting through the chat. Dr. Hunt, curious if your schools are doing reporting of violations, in parentheses, accountability.
I'll jump in at Western really quickly. The primary approach we have for students, which is something that they've all become comfortable with, which is the positive reinforcement, looking for the good things that are happening and trying to reinforce that behavior. That being said, we have some students, so we've sort of asked every student to classify themselves based on scenarios, and you'll get to scenario play here in a little while, whether they feel like they'd be more passive, moderate, or active with regard to their response to a particular scenario. And so we do have some students that are far more comfortable, at least in the role-playing environment, and has turned out to be more comfortable in actual life, in being active in a particular moment in those scenarios. And those students that are more active have asked, how can we report certain types of behaviors if we feel like we need to? Like the biggest one is not wearing a mask inside of a building. That's really like a kind of a black and white issue, right? Like it's pretty clear in that environment that you need to be having a mask on inside. It is an absolute mandatory requirement on our campus. And so we have protocol for how to handle that based on whatever building it's in. With regard to reporting things on a larger scale, we have like this threshold, like if someone threatens your existence because you're there trying to help someone and someone's like, you're an ambassador, you're a dummy, I'm going to attack you next time I see you over here for helping try to make people better. If that happens, we have a sheet. It's like a special crib sheet with 4 special QR codes based on types of scenarios that might happen. And one of those is like the DEFCON 10, someone's threatened your own health and safety, and you feel like this needs to be reported. They can take their phone and scan that QR, and it takes them to the things they would need to do next based on the circumstance, if that makes sense. And so we are not working from a place where our goal is to call out bad behavior or incorrect behavior. That's not the approach we've taken at Western. We've really taken the positive reinforcement, but we've provided space for folks who want to be more active and engaging in those moments, and we provided the tool to follow up safely in that environment. So Yeah, so we are reporting those violations in some cases, but that's not across the board. That's a case-by-case scenario.
I will share from UNCA. I'm putting a link here into the chat, and this takes you to our dashboard. So our essentially case numbers. And then if you scroll down to the bottom, there's a reporting form that folks can use either to report a positive test if they get tested off campus, for example, or a concern. And what we have heard is that mostly this form is being used, it hasn't been used a lot, but it's been used to report concerns related to things people have seen around campus. According to our friends in residence education, they actually haven't seen a lot of violations, and it's mostly been really low-key stuff like, hey, just a reminder to wear your mask while you're in the halls or while you're in the laundry room. And so far there haven't been any student, faculty, or staff reports of anybody resisting or really flagrantly violating our policies and expectations.
Thank you. I just wanted to provide some context. We were looking at the idea of having an accountability forum, not just for the ambassador program, but just in general across the Mars Hill community. So I didn't know, with the emphasis on educating versus enforcing, kind of a backup scenario for our students, where they don't feel the pressure to police the campus and things like that. So I was just curious if you all had that in place. Thank you for letting me know, though.
All right, I'm not seeing many questions come in. And if it's easier, I think we might be small enough you could unmute and perhaps try and jump in if you do feel more comfortable doing that. But we have some great resources available to us for a couple more minutes. So if anything is coming to mind, please let us know.
Haley and Alexis, I'm wondering if you feel comfortable, if you would put your email addresses in the chat, if folks could reach out one-on-one if they want to connect in that way. Thank you.
I have a question for Elaine. What is the sort of response rate of the wellness walkers or the ambassadors after they have done their wellness walks in terms of filling out that form? Are most of them doing it?
Yeah, it's 100% because our program is on educational stipends. And so we get to see the students when they come in to get their materials. And then we know their shift is ended when they've completed their follow-up form. So we've had 100% completion on that this first week. Yeah.
It's great.
The last thing I'll say really quickly before we move on is I'm really interested to see what happens, particularly because we crunch our test to positive to percentage rate positive rates on a weekly basis, sort of Sunday night, and we present that on Monday. So that's an important sort of figure for us to keep our eyes on, is when you start to cross what percentage of people who are being tested are coming back with positive COVID tests. That's an important figure. We're at 12.4 right now at Western, and that's just from this last Monday. So it's going to be interesting to see where we land this Monday. And I think at some point we're going to start being able to attribute some of the successes, right? Fingers crossed, knocking on wood, that we're going to experience with the Catamounts Care Program and the SHAs at UNCA, and then you all on your own respective campuses. So that's an important figure I recommend all of you consider watching for.
Sorry, you said 12.4% test positive rate?
Yes, yes. Compared to the state, which is around 6 in our worst, we were at around 8 nationally. We're hovering around 6 right now anyways. And I think Chapel Hill and NC State punched upwards towards 24 and 31% respectively. So at different points along the journey. So that's an important factor, is how many of your tests are coming back positive.
I will mention too that both UNCA and WCU are a good bit bigger than your schools. So the sort of numbers and ability to work in teams and all of those kinds of things, the number of ambassadors and those sorts of things are likely going to be different for the different institutions, but just I wanted you all to get a good sense of the kinds of things that students are, the ambassadors are doing.
Okay, well, I think we are ready to transition. And so again, thank you so much, Alexis and Haley, and Dr. Perry for joining us. Okay, so we are going to actually transition into COVID-19 basics, and I'm going to stop sharing, and I'm going to turn this over to Cole.
Right, thank you. Let me see if I can get that pulled up. Am I going to be sharing my screen for the presentation right now? Is that correct?
Yes, go ahead and share your screen.
Okay. All right, how's that looking? Can everybody see that? Cool beans. Okay, cool. All right, guys, we're going to go and quickly talk about COVID basics. I know everyone here most likely has heard way so much information about this already, but we're going to make sure we're all going to be standardized on what we're all going to be knowing moving forward. So let's watch this quick debriefing video from the World Health Organization, okay?
In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future. So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's a quick look at this emerging infectious disease. We're still learning about this virus every day, and what's known may change. So please, check the website below for the most up-to-date information.
All right. So video highlights from what we just watched, you guys. This is a new novel coronavirus, and we're going to be having to deal with it together. We're not quite near even having a vaccine ready. So it's really important that everything we're doing, everything that you guys are doing on your campuses, we're collectively doing together. Now, this is primarily spread from person to person. We're asking that this is observed by people keeping a 6-foot distance and wearing masks, because again, this is spread by respiratory droplets traveling through the air and things that are lingering. Even if somebody sneezes and walks away, it's still there for a little bit longer. Now, people can also spread this asymptomatically. People who have no symptoms and won't actually contract it, people who don't even show that they're sick. And so, that's why it's really important that everybody takes this seriously. Now, again, we're going to be talking about symptoms and prevention in a little bit, but I just wanted to show you guys and have you be informed about what are riskier behaviors, even on and off campus, you might be participating in and you might not know are super risky. For instance, super low risk you might be doing on campus, opening the mail. That's really probably the lowest transmission event you could be doing, all the way up to the top being, attending a religious service or going to sports stadiums. I mean, sports are kind of suspended at the moment for large gatherings. But just to keep this in mind, as being together with a lot of other people where you're close and close can actually cause a lot of problems moving forward by possible transmission rates. Now, if you're feeling sick or if you might have symptoms of something you think might or might not be COVID, we want to really suggest that you talk to your health and counseling service. This is a great example of something that UNCA has put together. And you can see on there, they give you the phone number for the counseling service. They want you to call right away. And they actually list possible most common symptoms of COVID-19. So like fever and chills, shortness of breath, body ache, loss of taste and smell, sore throat. And also in a small number of cases, we're now finding out that GI disruption and issues are becoming more popular. So if everybody's having these kind of issues on campus, you want to encourage them softly and politely to check out the health and counseling service, okay? Now, prevention strategies. We want to make sure that we emphasize the 3 W's, right? We want to wear that mask, the double-line mask, or really anything will be effective, but we want to try having something that's actually going to be containing anything you're breathing out, not just gaiters, something a bit thicker. You want to wait and actually have people spread out at least 6 feet between them, and wash your hands as often as possible, because we touch a lot of surfaces, including our face. Even as we've been watching the Zoom call, just notice. You want to keep those clean. One of the biggest questions is, how are we going to help students keep this contained on their campus? Well, that's going to be unique for you guys in each of your campuses. My position here on the program is going to be helping to coordinate between all 6 schools to actually make sure that you guys have the resources and the collective knowledge to share with each other, so that if you find something that really works well on one campus, you can share it with somebody else on another campus, via your lead and myself, and we can try, sharing the knowledge and keeping everybody as, proactive as possible, because we don't want to be late responding to things. We want to be early and using prevention and not reactivity to getting to the root of these problems. So we're going to be showing you guys 2 videos right now. These are both made by UNCA and are great examples. They're about a minute long that talk about student health ambassadors exactly in your position and what you guys might be going through, kind of translating the basics of COVID and also understanding what we'll talk about later on is bystander intervention and more of the specifics of your job. But this kind of gives you an early look at it. So this one's going to be about tight spaces in laundry room areas, okay?
Hey guys, do you mind waiting outside the laundry room? There's a maximum occupancy of 2 people in here, and all the washers are closed, so I think I'd feel more safe if you guys just waited outside.
Yeah, I don't understand why you're so uncomfortable. It's just me and my close friends. We've hung out here before plenty of times.
Yeah, I get it, but I am uncomfortable because we are in the middle of a pandemic, and I don't know if you've been in contact with someone maybe who is asymptomatic and you just don't know that. So I just think it'd be safer for all of us if we could just separate ourselves a little bit.
I don't think we're gonna leave. We have a right to hang out here.
You do have a right to hang out here. I think it'd just be best to follow the community guidelines so everyone can feel safe and comfortable.
Okay, we'll leave.
Thank you so much. I appreciate it. I'm sorry for the inconvenience, but we're gonna get through it eventually.
And that's a great example for you guys. You guys are not enforcers by any means necessary. We really want you guys to be proactive, just telling people, hey, we currently are in the middle of a pandemic. This is a super rare occurrence. Can we all agree that we're not going to be in these super tight spaces? Maybe 3, 4 more people, whoever the limit is in an area. Just try to observe that, tell them, communicate it. Will be the best way to communicate with everybody. Now let's take a look at the second example. This will be kind of helping your friends understand their symptoms if you notice that they're acting a little bit differently. So let's check this out. There you go.
Hey, are you feeling okay, Jenna?
No, I'm not. I don't feel good at all.
Yeah, I can kind of tell. What's going on?
I feel sick. Haven't been able to eat. Don't have any taste. I just feel awful.
I noticed you didn't go for your morning run and you're kind of breathing short. You're like short of breath?
Yeah, I definitely can't. It's hard to breathe.
Do you get the emails in the morning, the daily COVID symptom check, the self-check?
Yeah, I've seen that email. I haven't opened it.
Okay. I've definitely read them the first couple of times they came through, and it kind of seems like you might match some of the COVID symptoms.
I don't really want to go get tested because I heard that even if it's negative, I still have to quarantine until my symptoms stop.
It's probably better to go into quarantine for 2 weeks than to have to move all of your stuff back home for the rest of the semester, right?
Yeah, I guess so.
All right, so yeah, another great example of what you guys will be doing and what UNCA and Western have already kind of been talking about doing, and they've already done themselves, is really just being a proactive person on campus, telling people, hey, I know that you're kind of acting a little bit differently. Did you have a problem with something? Did you, happen to be going out this weekend? Yeah, you're kind of feeling weird afterwards. Maybe you contracted something. Maybe you're showing symptoms. Check it out. We can get you maybe tested. Now, again, we're going to be talking about 3 W's. Wear that mask, stand about 6 feet apart from people, and wash your hands as often as possible. When you're in around other places or people, you want to be away from crowded areas, close contact settings, and confined spaces with other people. Those are like absolute no's, just to be as safe as possible temporarily, because this is not going to last forever. What does that mean for everybody? Well, avoid the crowded areas, maintain your distance. If there are windows in an area or a room, open those up because you guys can ventilate it, let anything that's kind of the stagnant air that's been collecting kind of easily rush out and keep it fresh. cover any coughs you guys might have. It's not a joke. We don't want anything, just hanging out and looming in the air, because germs do hang out in rooms for several hours or longer. So we really want to keep that down to a minimum. Again, we have the precautions set in place that you guys know what you're going to be talking about. What does that translate into when it comes to college? If that's in a dormitory situation, you might want to keep your items, avoid sharing items with other roommates. If that means that, like, in your bathroom settings, don't keep your toothbrush next to other people. If you guys, want to wrap up the edge of your toothbrush so that, things in the air aren't collecting on it, that's a great idea. Kind of keep it like you're traveling at a hotel a little bit. Just take precautions at this time. With dining hall and meals, we're asking that if you guys have grab and go options, emphasize that that's really cool for students to do, and that they should be using that, because, that'll keep people from congregating in areas where if somebody happened to, contract it asymptomatically, then they're not going to become a super spreader and stand around a lot of other people, not showing symptoms and getting people sick. And in the laundry room, like you guys saw a little while ago in the video, just emphasizing, really small areas, how things can get, spread pretty quick, just keeping those to a minimum, making sure that people know the guidelines and just keep people safe. Now, the impact of COVID-19 so far in the world, we all know this, it's been pretty dramatic, and, almost 24 million people have contracted it globally, with almost, 1 million deaths. Just in our country alone, we've had about, 5.7 million cases and far too many deaths because of this, a lot of them being with older populations, but a lot of people who are also very healthy and virile. So we want to make sure people are actually not going to be able to contract this any longer. Even in North Carolina, we've had about 158,000 cases, even more locally than that. Buncombe County, guys, we've had over 2,300 cases and 67 deaths. This is not a joke. We want to keep people as safe as possible. Some of you will be located in Transylvania County. You guys have had 215 cases, and some in Jackson at 473. So already a lot, but we want to keep it as low as possible. Like Dr. Lang was mentioning earlier, percent positive coming back, that just means the amount of people who are being tested and the amount of people who from those tests are showing positive. In Buncombe County, about 4 out of every 100 people are showing that they are positive. In Transylvania, it's about 7 out of 10, and then Jackson about 5%. Okay, so I'm gonna try using the chat feature right now. If you guys can try saying, what are some specific ways that COVID-19 has impacted your college experience so far, just in the past couple of weeks that you guys have, been in session? Let's see if we can turn that on right now. Hold on here. All right, what are people saying? Yeah, of course, spending time with friends has been so much harder, right? I know that all of my friends and I were just Zooming, and it's not the most fun thing to do, but it works, doesn't it? Like for what we've got. Let's see. Any other thoughts about ways things have been harder? Sports season pushed back. Yeah, I know that's been really hard for a lot of people. I know that I've really enjoyed going to UNCA games as an alumni, and I can't do that. And that's really been hard. Let's see, it's impacted the way we can join as a student body. We've had to gather in different ways. I know, and the thing to remember, this will be temporary, you guys. This is not going to go on forever. It's the worst pandemic in about 100 years since the Spanish flu. We have to remember, that was a while ago. We're dealing with the same types of prevention measures today, and we will get through this. And it'll, end faster the more serious we take this as a country and as a world. So, oh yeah, not be able to be interactive in class using campus resources. Yeah, I would miss that too. All right, and last exercise I'd like us to do is, if we're able to, I might actually stop sharing my screen in a moment, but we're gonna do some breakout groups, okay? And I want you guys to think about, now that we've talked a little bit about problems on campus that you've been noticing, ways students have been limited, what are some immediate solutions? Like, what's like a quick program you guys can whip out and just think about? If you've noticed that it's harder for people to do social gatherings, okay, tell me right now in your breakout sessions when you come back, how you could design a way for people to have fun, interactive, safe meetings, whether it's over Zoom and you guys do really cool things, or whether it's maybe in person, but like way spread out so that you guys are not going to be unnecessarily passing along any germs, okay? We'll do this for about 5 minutes. We'll come back at around 2:15.
All right, cool. So I think we're all back.
All back, awesome. All right, guys. I think our group's small enough that if you want to raise your hand or maybe just, motion, unmute yourself, and you can give us an example of what you guys thought of as a solution to maybe an immediate problem you guys have already seen. Let's see.
Oh God, I didn't want to be the first one to talk. Okay. Well, we kind of came up with some ideas that maybe could bring like people together, especially with everyone thinking that they can't really like have like a social life on campus. Specifically Mars Hill, we have a lot of, I was explaining how we have a lot of land that we don't really like use. So I was like saying how we could possibly have like an outdoor movie night maybe, or like bringing like yoga outside, or like having like classes was brought up. And like also talking about like athletes and stuff, because a lot of the seasons are being cut. So we were talking about that too.
That's actually a really good suggestion. Something I would love to tell you guys, maybe to help remedy that. So let's connect you with resources. If you guys are noticing that at Mars Hill that you have this abundance of resource, what I would suggest, tell your lead. I can't remember exactly who their name is, but you tell your lead some of your ideas about something you're seeing as a lack or a gap in need and actual how you can fulfill it. And I can connect you with UNC Asheville, and their rec center is actually taking students, and they're making it to where they can do exercise programs over Zoom, or they can do them at the campus, but they can sanitize like an area outside. They're all the mats, and they can all do yoga together outside. As an alumni, I've been seeing their videos on Instagram when they do this, and they're really cool. So that's something you'd want to talk to your team about, talk to your lead about, and then they can communicate up. So we can connect you guys with other campuses doing the same thing. Thank you so much, Sabrina. Is there anybody else who wants to give an example? We've got about maybe 2 minutes left.
Cole, I just have a question. Oh, yes. Are other schools utilizing their athletics programs or different departments, constituents on campus to somewhat extend the student health ambassador reach, so to speak? We talked about maybe having a representative that our ambassadors can work with for each of our teams, which is a large portion of our student body, to help extend that role modeling. I don't know if other schools are doing that as well.
I'm not positive, actually. It's a great question. I know that UNC has several teams like you guys were seeing recently that are divided between like 10 different topics. I think when I talked to Jordan, I think she might have mentioned something about that. She will actually be on the call in just a moment, and so we can ask her before she leaves to that question. But as of right now, I'm not positive. Sorry about that. All right. Thank you for that, Steve. That concludes our section of COVID basics. Thank you guys for not falling asleep, or if you are, thank you for having the decency for turning your video off. It's really cool. And we'll turn it over to Ms. Jordan Perry. Take it away.
Hello, friends. I am popping back in from another meeting because I'm in multiple places at once today, like I'm sure many of you are. And I am going to talk to you next about some information related to evaluating health information. So I'll go into, Steve, if you can make me a co-host again, then I can share my screen. Cool. All right, you should see a blue screen that says evaluating health information, because that's what we're going to talk about right now. First, I have a quick poll for you. So I'm going to go ahead and launch the poll. You should see it on your screen. And this is anonymous. My goal is just to get a sense of where folks are getting their health information. There's not a right or wrong answer. It's just to prompt our discussion. So where do you get most of your health information? Google searches, social media, friends, family, health professionals like doctors, health promoting organizations like the CDC and World Health Organization. And note that you can choose multiple, because I know I get my information from multiple sources. So I've heard from most, but not all folks. I'd love to hear from a couple more. Okay, great. Got most folks have responded. Oh, no worries, Lizzie. That is totally okay. I will go ahead and share the results with you. So you should see the results on your screen. Steve, can you give me a thumbs up if you can see the results? Cool. All right. So looks like about 65% of folks are getting their information from Google searches. Makes sense. That's a great place to start. Also, 65% are getting it from health promoting organizations, which already puts you ahead of the game if you are looking to places that we mostly know to be reliable sources of information. And then we've got about 47% of people getting it from social media, really common, 41% from family, and 35% from health professionals, 18% from friends. So thanks for sharing that with me, y'all. Again, just to get a sense of where we're gathering our information from. I will say that compared to the general population, you're getting a little more information from health promoting organizations and a little less from your friends and family than the general population, but you're pretty close there. So, common sources of health information in our culture, Western American culture. We're talking about information coming from research, which can come from universities or health promoting organizations, which can be for-profit or not-for-profit, right? And that influences the information that can be coming out. Usually research then gets filtered through the media, which includes TV, websites, newspapers, etc. And then it often gets filtered through the people in our lives. So those could be health professionals, friends or family, or celebrities and influencers. And unfortunately, celebrities and influencers have a lot to say about health, right? Kim Kardashian is trying to sell us on that flat tummy tea, and Gwyneth Paltrow is telling us to steam our vaginas. And let me tell you, it gets real complicated, right? I put a telephone on here because I wanted to draw an analogy. Did anybody ever play that game, Telephone, when they were a kid? You often played it in an elementary school classroom. One person would have a secret that they would start to share and it would get passed around the room. Yep, Lizzie played it before. Maybe a few other people have played it before. And what happens with that secret in the game Telephone is often what happens with our health information. As it gets shared and passed through our filters, it gets a little bit distorted. And sometimes the message we start out with is not the message we end up with. And that's how something happens like this. Say a university comes out with a study that says cacao in chocolate is really good for your health. Cool. And then the media grabs a hold of it and we hear chocolate will save your life. And then you get an email forward from your aunt that says Hershey's Kisses are better than eating vegetables. And that's how information passes through our different filters, and it can become distorted. That's not to say that people are out there trying to distort our information, although I'm suspicious of Gwyneth Paltrow. It's to say that as we put the information through our biases and through our filters, it changes. We take what we want from it, we leave what we don't want, and it changes. So what I want to talk with you now about is some strategies that you can use for making choices about the health information that you're consuming. As student health ambassadors, you're going to be consuming a lot of health information and potentially sharing it with others. So it's important to do so with a critical eye. One tool that I want to introduce you to is called the media bias chart. It's an annual chart that gets produced by Ad Fontes Media, and some of you may have seen this before. The way this chart is organized is on the left-hand side. It's ranked from top to bottom in reliability. So you'll see things at the bottom that are very low on the reliability scale, and things at the top that are high on the reliability scale because they do what's called original fact reporting, as opposed to telling stories, or even in the case of the National Enquirer, making up stories about the alien baby that Dolly Parton had in 1975, right? From left to right, what you have is bias. The left being biased towards a left political affiliation, and to the right, biased towards a right political affiliation, or more conservative. What do you notice? What stands out to you about this chart? Use the chat to let me know. What do you notice, or what stands out to you about this chart?
Well, more reliable news networks seem to be more neutral.
Good point. Thanks, Yuri. Seem to be a little bit more neutral. What you're pointing to is in that teal box here. I don't know if you can see my cursor, but this teal box here, where you've got your highest reliability and your most centrist or most neutral bias. What else stands out to folks? I'd love to hear from at least one other person. No worries, we can move on if this is not a particularly compelling chart for you. One thing that always kind of cracks me up is that the weather channel is on here up at the top. I like that. So this is just one tool that I use as I have conversations about how to evaluate sources of information. Just check the media bias chart to see where a source ranks, or if I am making decisions about the information I'm going to share, I'm going to share things that are from this most reliable, most neutral square here. That's primarily what I'm going to look to for my sources of news. Or if I'm looking at something that I know has a bias, I'm going to keep that in mind as I'm consuming that information, or I might even balance it out with another source that I know has a different bias. So some strategies that I want to share with you that you can use as you're evaluating health information include the things that are listed here, and I'll highlight a few for you. Some keywords that often tell me this information might not be the most reliable are secret, magic, something they don't want you to know. Doesn't mean the information is terrible or wrong. It just means it warrants a closer look, because you don't really have that many secrets anymore when it comes to health information. And health professionals are people too. They deal with diabetes, they deal with cancer. Sometimes you'll see conspiracy theories floating around, like they don't want you to know that there's a cure for diabetes. Well, I would be willing to bet that there are health professionals out there who have diabetes or who have family members with diabetes, and they want the cure to get out there, right? Looking at the web page extension is another good source of information. Generally, not always, but generally, .orgs, .edus, and .govs are a little bit more reliable than, say, bobshealthfacts.net or something like that. Notice if the information is up to date or if it's been recently reviewed. Often reliable sources will have a review date on the page, so you can see, okay, well, this information was published in 2015, but it was reviewed in 2019. That tells you that somebody's keeping an eye on the information and is keeping it up to date. I also encourage you to consider where the information is coming from. Consider who paid for or is sponsoring the information. You can find that out if there are ads on the page. That tells you who's sponsoring it. consider looking at what the ads are like, right? That gives you some information about what the source is willing to share. And one thing to be aware of is something called astroturfing. Astroturfing is when an organization is made to look like it's a grassroots organization, but it's actually a corporation or a special interest group that has made itself to look like a grassroots organization, but it's actually not. So astroturfing is something to watch out for. You can look for an about or an about us page on the resource. That can give you information about who is creating the information. Take notice of the makeup of the board or the staff. Note any diversity that they have, right? I'm gonna be looking for a source with a board or staff that's more diverse than it is homogeneous, if that makes sense. I think the most important thing to consider is who benefits from this information. And benefit isn't just money, but that's an important component of it. Benefit is also clout or influence. It's financial gain or ad revenue. It's also your personal information. A lot of websites make a lot of money off of selling your personal information. So any website that's asking you to enter your personal information, I would just be a little critical of that or a little wary of that. Another thing to consider is if the source references reliable or credible organizations. If they're referencing things that the World Health Organization said, that for me means it might be more reliable than, again, somebody who's referencing bobshealthfacts.net. I don't actually know if that exists. If it does, I'm sorry, Bob. I also want to consider if the organizations generally agree or have consensus. If there's consensus in the field related to research, if there's consensus related to quote unquote best practices, that can be really helpful to know. A few other things that you can consider as you're looking at health information is if they actually cite research, right? And how do they cite it? Do they link to the research so you can read it yourself? Or do they really vaguely say, a research study said, right? You also want to note if there's consensus or agreement in the research. If half of the researchers say, well, we think that coffee causes cancer, and the other half say, we think coffee prevents cancer, that's not consensus, that's not agreement, right? A phrase you can pay attention to is peer review or peer reviewed. And essentially what that means is that other folks in the field have taken a look at this research and said, you know what, this seems generally above board, seems generally reliable. Calling something peer reviewed doesn't mean it's perfect or that it's correct, but it does mean that other folks have reviewed this research and found it to be mostly sound. Now, if they do cite research in the information, one thing you'll want to pay attention to is if the research was actually done in humans. Often folks will start out with animal trials or other kinds of trials before the research is even done in humans. And that's a normal and important part of research, but is it fair to draw conclusions based on that research? If it's done in humans, the next thing you can look at is how many humans. It's a big difference if they're talking about 26 humans versus 48,000, for example. I could survey all of you, and let's see, there are 21 of us here in this room. I could say 100% of the people in this training think that I'm awesome. Well, that's an N of 21 people, including myself. That's not exactly reliable research. And then which humans? That's an important consideration as you think about where research is being done. Who do you think is the population that is most frequently participating in research? Who do you think it is? Answer in the chat or unmute. Who do you think it is? Lizzie would hope professionals. So who do you think is the most common research participant or research subject? That might be language that is familiar to you. most common research subject? It's y'all, university students, particularly psychology students, right? And as lovely as you are, you don't necessarily represent the population as a whole. So if research is only being done on college campuses and only with college students, is it really fair to draw conclusions based on those populations? Just something to consider. And if there are research methods in the research that hopefully is getting referenced, another thing you can look for is if there's a control or a comparison group. So again, I could take this group of 21 of us, minus me, divide it in half, put you into 2 groups of 10. Say I give some of you, half of you, a magic pill that's gonna make you get smarter. Say you suddenly become smarter after taking this pill. Awesome. But unless I have this other group of people, this control group of people or comparison group of people to say, hey, we gave this group the magic pill, we didn't give this group the magic pill, the group that got the magic pill got smarter, that helps me more confidently say that the thing I did, the magic pill I gave you, caused the outcome. If there's not that control or comparison group, it becomes more difficult to say that the thing that we did, taking the magic pill to make you smarter, is the thing that actually caused the outcome. So control or comparison groups are pretty important when it comes to research. Finally, I would encourage you to look for what's called either a meta-review or a meta-analysis on the topic. A meta-review or a meta-analysis pulls all of the available research together and says, okay, here's what all the research says, and here's essentially what we can conclude based on the research that's available. A meta-review or a meta-analysis is really helpful in determining or in synthesizing or pulling together what everybody is saying in the field related to that topic. For example, I recently looked at a meta-review of the research on mask wearing. There's a lot of research out there on mask wearing, and different researchers have different outcomes. And so a meta-review or meta-analysis pulls it all together and draws conclusions based on all the research that's out there. And that's a really helpful tool to have. I'm gonna check the chat. I got a couple of chats coming in. Yeah, Lizzie brings up a blind study or a randomized control trial. That's the gold standard in research, right? A randomized control trial. And so if we were doing a randomized control trial in this group, I would randomly assign folks in this group to either a study condition, taking the pill, or a placebo, taking a placebo pill. That is the best way to do it. That's not always possible or practical or even ethical, right? Imagine we were doing a study on food insecurity in college students. Well, I couldn't randomly assign some of y'all to be food insecure and some of you not to be, right? So yes, randomized control trials are the gold standard, not always possible, practical, or ethical. Okay. So I'm gonna give you a couple of article links. I will start with one. As you take a look at the article, and I'll link it in the chat in just a moment, what do you notice? And I want you to decide if you would consider the article to be a reliable source of information or not. So grabbing that link for you. It's from the New York Post, which appeared on our media bias chart. So go ahead and click that link, take a moment to scroll through it, and notice whether or not you feel like that would be a reliable source of information or not. So as you're starting to read this, what are you noticing? Feel free to unmute or use the chat. Lizzie says it's taking a while to load. It is. I wonder why that is.
In the first paragraph, whenever they're citing where the treatment came from, they just said 2 drug companies instead of saying the names of the companies.
Yeah, yeah, good spot there, good spot. What else? What are you seeing a lot of on this page? Lots of ads. It's really short, not a lot of information. And that's probably why it's taking a minute to load, because there's a lot of ads. One thing that is interesting too is that it's kind of hard on this particular page to tell what's a link to another article and what's an ad. And that to me is a little bit of a, I call it an orange flag. Like, oh, that's a weird thing that you're blending your ads in, so it's a little bit hard to tell. That tells me that they really want you to click on those ads because they're making money off of them. What else are you noticing? The whole website just looks weird. Amy says the headline is misleading. Yeah, the headline doesn't quite match up with the article. Doesn't quite look professional. Who wrote this? Who wrote this article? Yes, Cole, not a clear author, right? Finding out where the information is coming from gives you good information. And if you can't find out where the information is coming from, that really tells you something. So, my next question for you is, would you consider this to be a reliable source of information? Why or why not? Feel free to unmute or use the chat. Amy says, no, there are too many details that suggest it wouldn't be reliable. Yeah, I agree. This is probably not something I would personally share or use, because there are too many unknowns and too many people stand to benefit from clicks on this page. All right, I'm going to give you another one to take a look at. This is from slate.com, and so I really intentionally, the first article was from the New York Post and the other was from Slate, and I intentionally chose two articles on different places on the spectrum of bias to represent. So go ahead and click on the Slate article and take a moment to look over it. As you look over it, feel free to share reactions or reflections, either in the chat or by unmuting. Yeah, Lizzie says it looks a little more professional. It's not quite as cluttered. There are still ads. There aren't quite as many. Ruben notices just by skimming over it, you can see stats and quotes. Nice, good catch, Ruben. There is an author listed. Yeah, thanks, Amy. There's somebody that you can go to and see what role they have. Some words are links to other sources. Yeah, good point, Lizzie. You can there are hyperlinks, so you can actually go and check the original research. Links to sources like the NIH and other good scholarly journals. Yeah, so references to health promoting organizations that have some credibility. Thanks, Jonathan. Yeah, Amy points out it's still just a .com and not a .edu. Yeah, so probably what I would do with this source, and again, I'm not saying that either of these articles are perfect, but one has a higher level of reliability than the other. If I wanted to share information from this, probably what I would do is I would go to the hyperlinks that they're linking to or the organizations they're linking to, and make sure that they're saying what the article is intending. Yuri pointed out it's a fairly new article, so it's probably maybe a little bit more up to date. Good, yeah, good catches, y'all. Thanks for that. So we just have a couple more minutes to talk about evaluating health information. I know that you all process and put out health information all the time, so I would love to hear from you. What strategies do you use when you decide what health information you're going to share or not. So what strategies do you use as you decide what health information you're going to share or not?
Usually it's good to just check multiple sources.
Yeah, thanks, Yuri. Checking multiple sources is a great strategy. Lizzie says, I like to do my own research on it. Good. Checking the credibility. Yeah, thanks, Amy. Check the credibility of the people involved. If there's a name of somebody that you can check out. Any other strategies folks use? Okay, any questions about evaluating health information? Any questions? Lizzie might be typing it. I will share that one strategy we ask our student health ambassadors to use whenever they're putting health information out there is to make sure at least one other pair of eyes is on it, right? So somebody else from your team, another student health ambassador, one of your advisors, make sure somebody else is looking at it before you post it. So Lizzie asked, if we're asked something we're unable to find out ourselves, who can we direct it to? Our leader. Yeah, I would say probably your advisor or the coordinator on your campus. You could also bring it back to your team and brainstorm with the team. Good question. All right, with that, we are at break time. Steve?
So 3:01, we will commence with the second half here.